We now request the President of the event, respectable Mayor Mrs. Snehal Ambekar, to do the honors for the next award, which is the Award for Excellence in the Field of Oncology. And the award goes to Dr. Anil K. De Cruz, Director, Tata Memorial Hospital, Professor and Surgeon Chief, Head Neck Services, Tata Memorial Hospital, Mumbai. Once again, we thank you, ma'am. Thank you, sir. Once again, we request Professor Dr. Rehan Kazi for some good words, sir.
Thank you, Dr. De Cruz, for being here. It's absolutely a pleasure to say a few words about Dr. Anil De Cruz, one of the brilliant gems to have come out from this country. In fact, the leading light in head and neck cancer, and in the years to come, he will be that authority in head and neck cancer that we've always craved for, Dr. Anil De Cruz. His CV is absolutely outstanding. At the moment, he's head of department at Tata Memorial Hospital. Ladies and gentlemen, you know the kind of service that Tata Memorial Hospital provides to the people of this country, not only Mumbai, and he's been doing that for the last several years. He's been teaching, presenting, shaping the minds of young surgeons who pass through the ranks of Tata Memorial Hospital, go back to the different parts of the country and continue the head and neck service and excellence that they've been brought up and taught by Dr. Anil De Cruz. So ladies and gentlemen, a few words about Dr. De Cruz. He's the director of Tata Memorial Hospital, Mumbai, chief of the head and neck surgery and the services. And bear in mind that Tata Memorial Hospital is one of the busiest in the world, registering 7,000 new cases, performing over 2,000 major surgeries every year. It's a fantastic achievement. He is originally a graduate of St. John's Medical College, Bangalore, completed a master's in general surgery, MS at University of Mumbai. Thereafter became a diplomate of the National Board of Examinations, New Delhi. He's one of the few in the world who have been awarded an honorary FRCS, Fellow of the Royal College of Surgeons of London. So he has been appreciated worldwide. He teaches the MCH specialty, the super specialty of head and neck in surgical oncology, and has been, like I said, training and teaching postgraduate doctors in ENT, head and neck, general surgery to actively take up head and neck cancer when they move out for private practice and in public positions. Dr. De Cruz is a member and chair of several professional bodies in India and abroad, and has recently completed a tenure as the president of the Foundation of Head and Neck Oncology, the highest body in this country, for 2 years from 2008 and 10, and was also the secretary of the Action Council of Tobacco Control from 2007 to 9. He's also a member of the Task Force for Chronic Diseases at the Department of Biotechnology at the Ministry of Science and Technology, Government of India. He's also currently the president of the Asian Society of Head and Neck Oncology. So this is no mean achievement, ladies and gentlemen. He's actively involved in research in head and neck cancers and has played a pivotal role in several national and international head and neck cancer trials. He's been the global PI and part of the steering committee of several multinational, multi-centric countries and trials, all over the world. These include a number of pivotal phase 1 trials. His major interest is in obviously head and neck cancer, but primarily in the management of neck metastasis, conservative laryngeal and laser surgery, cancers of the oral cavity, the thyroid, as well as importantly, quality of life issues. He's doing several trials at the moment, as well as some pivotal pioneering trials, working actively with the Government of India, and he's also working on several molecular cytogenetic projects in oral cancers. Dr. D'Cruz has published more than 125 peer-reviewed publications in peer-reviewed journals, as well as written several chapters in leading books. He's also the editor of a textbook on head and neck surgery. He has been invited and delivered more than 250 lectures both nationally and internationally. And he's been the guest faculty at several international head and neck societies. Ladies and gentlemen, there can not be a more deserving recipient of this award, Dr. Anil D'Cruz. So, on behalf of the Cancer Aid and Research Foundation, please give Dr. D'Cruz a standing ovation for his outstanding contribution in the field of head and neck cancer. Thank you, Dr. D'Cruz, for being here. Please share a few words with us.
Good evening, everybody. Rehan, thanks for the kind words. I'm embarrassed. I don't know what to say. But I must thank CAF for the honor of this award. For me, it's a very special award for two reasons. One, today is the foundation day of Tata Hospital. On the 28th of February 1941, the Tata Memorial Hospital started. So today is our foundation day. And I think it's a very, very nice day. I had two minds whether to accept it because we have big programs going in Tatas. But I thought it's an ideal time to receive this award because it's the hospital that gave me the chance to excel. And more importantly, my patients who gave me a chance to deserve this honor. So I thought it was a wonderful day and thank you so much for this honor. The second reason why it's very important to me. We get a lot of awards, but our professional bodies look at our publications, look at our presentations. They don't look how we treat our patients. And organizations such as CAF did not really ask me for my full list of publications. They asked me what I had done. They saw how I've treated my patients, interpersonal relationships. And I think that's very, very important for us as doctors. Rehan, as you rightly said in your introduction when you felicitated Mr. Jaffrey, these kind of awards really help us rededicate ourselves to our patients and our goals. And thank you so much for it. I accept it with humility as well as honor. I noticed that CAF is a member of the UICC. And I'm on the board of directors of the UICC. And you all might be wondering why I'm telling you all about the UICC. The UICC is the largest NGO committed to the care of cancer delivery across the world. There are about 800 member organizations across 150 countries. And at the UICC, there are two or three major focuses of the UICC. One is to prevent cancer. And prevention is to make people aware of cancer. And I think CAF has the same philosophy. And it's important, and I must respond to Madam Mayor's talk about Mr. R.R. Patil, the tobacco menace. In our country, 50% of our population consume tobacco. Tobacco is responsible for close to 50% of all cancers across all registries. And unfortunately, in our country, the majority of people take to tobacco before the age of 20. We have patients who come from the interiors of Maharashtra at 35, 40 with cancer. They started tobacco at the age of 15. Young ladies in the interiors, they believed that tobacco was good for the teeth. They believed it was good for digestion. They had nothing else to do. And when I asked them, why did you take to tobaccos, they knew it was slightly bad, but they didn't know it was so devastating that it can cause a major illness like tobacco. And I plead to organizations such as CAF, people from the press, other people who work in organizations, doctors, to please take our politicians to take this message to people. We do it at functions like this and then forget. But I think this message has to go again and again to our patients. As you rightly showed in the beginning video, you have a choice between good health and not so good health. And I think if you tell people and really reinforce it, many people would not take to these harmful habits. The second philosophy of CAF, to reduce the equity. We have a lot of very good hospitals, but unfortunately 80% of our population cannot have recourse to those hospitals. I must tell you, certain leukemias, young children get, the treatment only costs between 2 and 5 lakh rupees, but and 90% cure rates. Acute promyelocytic leukemia, less than 2 lakh rupees for the entire treatment of the child. They can't afford it. And it's our duty in society to give those people that care. And I again congratulate CAF for supporting so many people, saving the lives of so many. So again, reducing the equity is so important, and making this treatment available to our patients. And I think your ethos mirrors what we do at the Tata Hospital, mirrors what we do at UICC. And it's important that we fight this battle together. I last want to thank all of you all sitting in the audience. Many of you all are donors. Many of you all support patient care. And I think in this battle against this deadly disease, it's not possible with doctors alone. Doctors only do half the work. The other half comes from support groups, from individual donors. And I thank each and every one of you for joining our battle and helping this place be much better for our cancer patients. So thank you once again for the honor.